And we'll closely monitor those developments with our correspondents and keep tracking the reactions that have been coming in so far from India, Pakistan and Afghanistan. Getting us ground details at the moment is our principal diplomatic correspondent, Siddhant Sibal, joining us from New Delhi, and our Pakistan Bureau Chief, Anas Malik, from Islamabad. We'll just in a short bit also be joined by Mustafa Kazemi from Kabul. Coming to you first, Siddhant, ever since the Prime Minister made that announcement of this initiative, support has come in from all the SAARC leaders, but Pakistan was hesitant in applauding the initiative of the Prime Minister and was forced to finally say that their representative will be taking part.
Well, Islamabad would have been in a difficult position had Islamabad said no to this proposal by the Indian Prime Minister Narendra Modi on a joint SAARC strategy to counter the epidemic. But the fact that reluctantly Islamabad has agreed and it will be represented by the health minister, by the special representative of the health minister. But do note that the video conference will have the Indian Prime Minister as well as the Prime Ministers and President of other leaders, barring one Prime Minister, that is the Prime Minister of Pakistan, Imran Khan. But by and large, a joint strategy, a regional strategy, and a re-emergence of SAARC, because after 2016, we have seen the group lying very defunct, and India focusing on the big mistake grouping rather than on the SAARC grouping. And it was said that SAARC is dead, the obituary of SAARC was written, but it seems that this could be a start point for SAARC to become very active when it comes to regional issues, regional problems. And also, if you look at India's strategy, India has been reaching out to foreign nationals. Well, let me tell you a fact that and since the outbreak of this virus, the coronavirus epidemic, India has evacuated 48 citizens of 10 countries from its various evacuation missions from Wuhan. 3 missions were sent to Wuhan, and from which India got so many nationals. Maximum were the Bangladeshi citizens. So clearly benefit to the regional countries, and also 7 citizens of Maldives.
Absolutely. Stay with me, Siddhant. Joining us is also Anas Malik, our Pakistan Bureau Chief. Anas, first, what has the Pakistani establishment revealed so far as to why Pakistan Prime Minister Imran Khan himself would not be taking part? Instead, it would be the SAPM representing him.
Well, there's only one primary reason why the SAPM on health, which is Dr. Zafar Mirza, is going to be part of this SAARC conference. The fact that he has been the lead person, the focal person who has been leading all of the coronavirus-related situations within the country. He has been actively engaging with neighboring countries as well, be Iran or China as well. You've seen just yesterday he was the one who was accompanying the Irani ambassador during his meeting with the Pakistani Prime Minister Imran Khan, and he was the one who had in fact taken the initiative and lead when to announce when Pakistan was one of the very first countries to send about 30 tons of medical supplies to China as and when the COVID came to light back in January. That is the reason the SAPM on health, Dr. Zafar Mirza, has been nominated as the person who would be representing Islamabad in this SAARC video conference. Having said that, Pakistan was in a very awkward position, or rather in a fix, because its rhetoric on Kashmir, given its rhetoric on Kashmir, it had to take one position or the other. It could not have said no by all means, primarily because it has been waiting for SAARC to happen. We've seen that meeting on the sidelines of the United Nations General Assembly of the SAARC Foreign Minister. The Pakistani Foreign Minister jubilantly exclaimed that the SAARC ministerial meeting and the SAARC summit is to be happening in Islamabad, and that it had not been opposed back then. So that is the reason the Pakistani administration by and large had been in a fix when this offer from the Indian Prime Minister came through a tweet, and that is why Islamabad wanted itself to be registered, and no other person, as the authorities here claim, would have been a better representation than the SAPM on health, Dr. Zafar Mirza himself. Yes.
All right. Stay with me, Anas. Going back across now to Siddhant. The larger message that comes in through this initiative, Siddhant, is also that of geopolitical maturity and how India is taking the lead when it comes to arriving at a coordinated response to tackle the coronavirus crisis.
Well, Molly, one thing I tell you, a short while ago, the Foreign Minister of Maldives has just tweeted thanking India for its help. India has been helping countries in the region. 2 requests came from the region, one from Bhutan, one from Maldives, to help to make sure that this crisis does not spread. We know that cases have emerged from both the countries. In fact, all these South Asian countries have reported case of coronavirus, and India has sent supplies to Maldives. So this shows that India's neighborhood first policy has been a top priority for the Modi government. But by and large, India now aims at a regional coordinated policy when it comes to fighting this epidemic, because this has been a major issue now globally. We have seen so many people dying because of this crisis. We also know that India's policy is one of the first policies calling for a regional coordination when it comes to tackling this challenge of the epidemic. And by and large, in the past as well, India has been reaching out to countries, whether it's Nepal after earthquake, whether it's developing infrastructure in Afghanistan, or whether it is connecting Bangladesh, also building houses in Sri Lanka. These have been India's past endeavors in the neighborhood, but now India is aiming at a larger coordinated policy to tackle emergency issues such as the coronavirus.
Right, and Anas, a quick check also on what the situation is looking like in Pakistan. If you can bring us up to speed with the latest number of cases and the measures that have been taken by Pakistan on the ground.
Well, it wouldn't be wrong to say that the situation has gone from better to worse in the past week or so, or precisely in the past 5 days. At the start of this week, we saw the number of cases of coronavirus was said to be somewhere around 8. By now, as we speak, the number of cases, the diagnosed cases stand at 30. So in about 5 days, 22 cases have come to light. Just yesterday, we saw 7 cases coming to light from Balochistan, let alone 6 of them those from being that of who were coming from Iran at the Taftan border. One in Quetta of a child who had recently returned from Iran as well. A while ago, the Pakistan Institute for Medical Sciences, PIMS Islamabad, which is the only quarantine and isolation facility in Islamabad for the Federal Capital Territory, they have confirmed that the first COVID case has come to light, and that patient, a 30-year-old female, had recently returned from the United States of America 2 days ago to Islamabad, and she is very, very critical. That is what the PIMS spokesperson says. As we speak, 30 people have been diagnosed. Only 3 have been successfully cured and sent and have been discharged. About 14 of them are from Karachi. In fact, 15 of them are from Karachi. One is from the Sindh province, Hyderabad in Sindh. The other one from Quetta, 6 from Taftan, and 5 from Gilgit-Baltistan. So about this is the breakdown. About 900 plus tests have been done. 1.1 million passengers up till date have been screened. The international flights have been curtailed to only 3 airports, Karachi, Lahore and Islamabad. KLI are only operating international flights. The rest flights have been diverted. So there seems to be some contingency plan, and as we speak, there is a high-level meeting of the National Coordination Council on COVID, which is being chaired by Dr. Zafar Mirza. That came to light yesterday. That came into being yesterday after the National Security Committee meeting. It is ongoing, and they would further be reviewing the steps that are to be taken in order to counter or in order to avert the spread of this COVID or novel coronavirus. Yes.
All right, we're going to leave it there for the moment. Anas Malik and Siddhant Sibal, thanks very much for those updates.